Welcome back to Inside Chlorpromazine. I'm your host Soumya, and today we are entering a fascinating and critical territory in the context of COVID-19, that is, the blood-brain barrier. Our episode today is titled Crossing the Line, Chlorpromazine and the Blood-Brain Barrier. We are exploring how chlorpromazine interacts with this delicate and productive interface and what this could mean for neurological symptoms in COVID-19 and long COVID. To help us understand this complex and important topic, I am joined once again by Chythanya, a microbiology researcher who's been exploring how drugs behave at the intersection of the nervous and immune systems. Welcome back, Chaitanya.
Thanks again, Soumya. I'm really glad we are covering this. The blood-brain barrier is like a high-security border, and any drug that crosses it deserves serious attention, especially in neuroinflammatory conditions like COVID-19.
Let's start at the beginning. What is blood-brain barrier and why is it so important?
The blood-brain barrier, or BBB, is a tightly controlled interface between the bloodstream and the brain's internal environment. It's made up of specialized endothelial cells, tight junctions, and support cells like astrocytes. Its main job is to protect the brain from toxins, pathogens, and fluctuations in blood chemistry. But this also means that most drugs, even some antibiotics, can easily enter the brain. Only certain molecules with specific properties can cross it.
And COVID-19 has shown a lot of neurological involvement, right?
Absolutely. We have seen symptoms like loss of smell, headache, confusion, brain fog, anxiety, seizures, and even stroke in some cases. There is increasing evidence that the virus or the immune response to it affects the brain. This makes drugs that can reach the brain especially valuable in understanding and managing these symptoms.
So, where does chlorpromazine come in?
Chlorpromazine is one of the few drugs that readily crosses the blood-brain barrier. It's lipophilic, meaning it dissolves in fats and has a molecular structure that allows it to penetrate brain tissue effectively. That's why it acts as an antipsychotic. It acts directly on the central nervous system, particularly dopamine receptors in the brain. But beyond its psychiatric actions, this ability to cross the blood-brain barrier means chlorpromazine can potentially modulate inflammation, viral entry, and neurotransmitter balance in COVID-affected brains.
What happens to the blood-brain barrier during infection?
It's a great question. In conditions like COVID-19, the blood-brain barrier can become compromised due to systemic inflammation and cytokine release. This breakdown allows immune cells, inflammatory cytokines, and sometimes even viral particles to infiltrate brain tissue. This is part of what's suspected to drive the neurological symptoms in COVID-19 and long COVID. Chlorpromazine could help in two ways. First one, by stabilizing the blood-brain barrier through anti-inflammatory actions and by acting within the brain to reduce neuroinflammation.
Does chlorpromazine affect immune cells in the brain?
Yes, it has been shown to modulate microglial cells, which are the brain's resident immune cells. When activated, microglia releases pro-inflammatory cytokines like interleukin 6 and TNF alpha, the same ones elevated during cytokine storms. Chlorpromazine appears to reduce this overreactivation, potentially calming the neuroinflammatory state. This could be helpful in both acute COVID-19 neurological issues and long COVID symptoms like brain fog and fatigue.
That leads us to an important question. Could chlorpromazine actually become part of a neuro-COVID therapy?
It's still early days, but the potential is definitely there. Most drugs can't reach the brain. The fact that chlorpromazine can and may even protect the brain makes it worth investigating further. What's particularly attractive is that an existing, affordable medication with decades of safety data. If future trials confirm its neuroprotective effects in COVID-19, it could be a game changer for long COVID management.
Could there be any risk related to its action in the brain?
At high doses or with prolonged uses, yes, chlorpromazine can cause side effects like sedation, movement disorders, and cognitive slowing. These are well known in psychiatric contexts. However, for anti-inflammatory or neuroprotective use in COVID-19, much lower doses might be effective. Doses that avoid many of the traditional safe side effects. Still, everything depends on rigorous clinical trials to validate safety and efficacy in the context.
To sum up, the blood-brain barrier plays a critical role in neurological COVID-19 symptoms. Chlorpromazine's unique ability to cross this barrier, harm infection, and interact with neural immune cells makes it a promising candidate for further study.
Exactly. It's rare to find a drug that can both penetrate the brain and have anti-inflammatory effects. Chlorpromazine is one of them. It deserves a closer look, especially in the post-COVID landscape.
Thank you once again, Chaitanya, for unpacking these complex ideas so clearly. I know our listeners appreciate the clarity and detail.
Always a pleasure, Soumya.
That's it for this episode of Inside Chlorpromazine. Join us next time for episode 12, Viruses and Vesicles, how chlorpromazine blocks viral entry, where we'll dive into the cellular mechanics of viral trafficking and how chlorpromazine can interrupt that process. Until then, stay safe and stay curious. Thank you.